Hello, my name is Chetna Musapeda, proud daughter of a Navy submariner. I'd like to welcome you to the Rural Veterans Health Access Program training module for understanding the conditions relating to moral injury when treating military personnel. This video provides treatment information to support veterans who come into your care experiencing manifestations of moral injury. We will explore the complex physical, spiritual, mental, and emotional challenges military personnel face during service, which impact them well beyond the deployment itself. All veterans have sacrificed for our country and deserve the highest quality, compassionate, veteran-specific care we can provide them and their families. Navy officer Dr. Irv Jansen with the Coffee Bunker in Tulsa, Oklahoma describes moral injury as injury to the conscience by doing or viewing events that violate our sense of right and wrong. Medical practitioners and clergy are becoming increasingly aware of moral injury as hundreds of thousands of U.S. troops are returning from deployment around the world. Dr. John Schumann, practicing internist in Tulsa, Oklahoma, described the differences between moral injury and PTSD in a radio interview in January of 2019. He explained that PTSD is a midbrain, fear-based response to situation, whereas moral injury is a cortical response to events involving thinking and introspection. Veterans suffering from PTSD will report insomnia, depression, or anxiety after deployment, which is an additional symptom of those suffering from moral injury. This describes the expression of regret for the action they participated in or had described by fellow military personnel. This results in turmoil in their spiritual life as well as general health, requiring a different avenue of treatment. As patients, veterans are sometimes hesitant to discuss service-related experiences to both medical and mental health care providers. Veterans hesitate to bring up personal concerns, having been trained to focus on the needs of those in their unit, not their own emotions or health. A common saying among veterans is, "We don't complain about the small things." Providers need to understand that veterans representing all branches are proud of their toughness, which makes it difficult for them to seek services and adhere to treatment. Healthcare systems and providers need to understand the unique and complex components of moral injury to effectively treat military patients. An understanding of moral injury can impact prompt initiation of care, proper perception of symptoms, and execution of proper treatment options. The moral pain experienced by veterans has an impact on their everyday life experiences. Moral injury reduces personal vitality, reduces a sense of focus, and can create a self-perception of guilt and shame. This also impacts the quality of interpersonal relationships, especially with family and close friends. Healing opportunities are missed if a healthcare provider does not have insight into moral injury, thus not providing the patient with the scope of care needed, as well as with compassion. It is critical to understand that both military toughness and the stigma related to any type of emotional or psychological condition make it very uncomfortable for military personnel to reach out to a provider with no experience in or with the military. Vet-to-vet comfort is the reason that simple talk therapy with military colleagues is a major step towards healing the many wounds of war. Organizations such as the Coffee Bunker in Tulsa are hubs of community where military personnel can come with no fear of judgment for anything they might be experiencing. Veteran treatment courts are municipal initiatives that intervene with legal assistance when military personnel have had brushes with the law by acting out violently or under the influence of substances, while trying to struggle with the aftermath of deployment. Listening circles is a practice which involves intergenerational conversations among military personnel who have faced and are currently facing ongoing challenges relating to military service. Dr. Rita Brock facilitates these impactful sessions through the Volunteers of America organization at the Shea Moral Injury Center. These programs aid with the reconciliation with family members of veterans who may have distanced themselves from the impaired loved one, as well as offering assistance when trying to return to employment. Dr. Jonathan Shea with the Department of Veterans Administration Outpatient Clinic in Boston and founder of the Shea Moral Injury Center states, "We need rituals, we need liturgies, we need artwork to help towards purification after battle. Recovery happens only in community when a conflict occurs between personal morality and the issue being faced." This concludes our video addressing moral injury among veterans. We would like to thank you for your dedication to the veteran population by participating in this training module. If you have additional questions regarding this content, please feel free to reach out to the email shown here.